Good day everyone, and you are welcome to our third video on the unit CHCAGE013, which is work effectively in healthcare sector. Please, if you are joining us, we have recorded 2 videos, so please try to watch those one while you join us on the third one. Today we are going to be starting with funding system. In our last video we touched it a little bit, and there's a little bit of glitch at the end of it, but yeah, we're going to be starting from there today. The funding system associated with healthcare services is what we call ACFE. So ACFE, for residential care to be specific, is how to claim the aid or the support that the service provider has given to our client. So all aged care facilities, they have to follow this particular funding system to be able to collect back the money that they've already used in supporting the elderly ones. Other than using the AFI, there is another funding the older person who have low income can also benefit from. This includes the Commonwealth Home Support Program, which is called CHSP. There is also the Home Care Package Program subsidy. This is to support people that are not yet in the facility, but they prefer to live in their home. There is the Home Care Package Program. There is also Community Assistance and Support Program. This is to assist the elderly ones to be able to maneuver and to be able to engage appropriately in the community. The Residential Aid Care subsidy is also to help in reducing or to help in supporting the low-income older people. Residential respite subsidy is also when the carer needs to have a rest, or we think the client themselves, they need like a change of environment. There is subsidy to support them in achieving this goal. Flexible care subsidy for short-term restoration care and transitional care program is also available to assist people in this sector. So all this funding, of course, there is a documentation that is expected to be stored, and in storing this, the governing body will come around to check how best this allocated amount has been put to use, and the accreditation system will certain. Accreditation is an official recognition that a provider is qualified to provide healthcare services, and Healthcare Quality and Safety Commission assess provider on this level of accreditation. This is to seek the to seek and confirm that the provider are actually providing the necessary supports that they said they will be providing against the quality standard, and this is done in contributing to improve the safety, quality, as well as continuous improvement services that they are delivering. Don't forget, we have like a standard that is healthcare are expected to maintain while supporting people in our care. While they are doing this, we can of course relate that to what it is a duty that is expected of them, which is duty of care. So this duty of care is a person's obligation to their job. As a care worker, we are responsible to not cause harm or injury to anybody that is in our care, and we should provide a reasonable foreseeable support or foreseeable control measure to be able to mitigate any harms that we even identify. It leads to what you should do as an aged care worker, and it relates to the Charter of Aged Care outright. You must perform your obligation to ensure that older people enjoy their rights. Your duty of care as an aged care worker include the following. 1. Providing safe and high quality of services. That depends, of course, depends on what is expected of you in your organization, and this can be different from one organization to the other. 2. Treating people with dignity and respect. 3. Informing people about their care. 4. Helping people maintain independence. 5. Preventing any form of neglect or abuse. All these are the duty of care that each care worker like you and I needs to always maintain. The aged care quality standard lists requirements that the provider, that is the owner of the organization, must meet. One of these includes 1. Protect the older person's rights, safety, and well-being. This standard covers the right of older people that must be met at all times by the providers. As I said earlier, the aged care quality standard has we have 8 quality standards. The first one is consumer dignity and choice. That is, we need to give them the right to make decisions on their own, and yes, with appropriate support from us. 2. Standard 2 involve ongoing assessment and planning with consumer. That is, the more they are in our care, I'm sure the more things are likely to change. For example, if they are getting better or there's a level of declining, there should be appropriate record to maintain and display that we are doing this. Standard 3 involve personal care and clinical care. Personal care is what the person likes to do on their own, what they believe they are capable of doing and what they've been doing, how we've been supporting them to achieve this. While the clinical care include what the nurses, the doctors, and other specialists are supporting them with. If someone is having some kind of pain, or even maybe they have some wound dressing that needs to be done, so we are going to be recording them in this area. Standard 4 involves service and support for daily living. This is one of the major aspects where we play a very vital role, because we are the one in front that supports our clients in achieving this particular daily living. This involves supporting them with showering, toileting, feeding, and the rest. And once we are carrying all these activities out, it is our responsibility to document them appropriately so that our supervisor or managers will have information at their disposal to make the right decisions. Standard 5 involve organization service environment. How safe is our environment? How safe is the equipment we are using? And how safe is everyone working in that environment? Are they happy? How conducive is it? This is where we talk about this. Standard 6 involve feedback and complaint. In any organization, having a very proactive feedback and complaint network is one of the expectation for the quality accredited body. So we should have appropriate record that display that we are doing this at all times. Human resources. This involves getting the right person to do the right job. There's might be a situation whereby we get staff members that are not fully qualified yet. But even if that is the situation, do we have a control measure in place? Are they working under supervision? Are they getting some in-house training? What are those support that we are providing for them? All this include in this particular standard. And the last but not the least is the standard 8, which is organization governance. How is our CEO? How are the managers and the board of directors? How are they maintaining their duty of care towards the client, towards the staff member, and even the entire community? So how are they doing this? This is where those standards comes under. The next thing we're going to be talking about is the CARD, that is culturally diversity people. So cultural diversity is the variety of culture in the society. Australians who are culturally diverse may face different disadvantages in finding services. So you and I, some of us that we even come from this particular background, how can we get the appropriate support? So the CARD community helps in mitigating this kind of bottleneck. And other people that are likely to be facing the same challenges are the Aboriginal and Torres Strait Islander, the lesbian, the gay, and the transgender, the religion or the regional and remote communities. These are some of the demography that can be affected with getting the right services, or that can be at the disadvantage of getting the right services. Risk assessment. As part of our role as aged care worker, we need to have it at the back of our mind to do what we call risk assessment at all times. So risk assessment involves evaluating the potential risk that may affect other person in our care. By us doing what we call risk assessment, we can easily minimize those risks or harm that are likely to befall our loved ones or our clients or even people in our care. So it is part of our duty as an aged care worker to always think about this and maintain safety of our clients. So knowing the risk allows you to take appropriate action to avoid them. Risk in aged care work role, that is the Work Health and Safety Act 2011 protects your safety as an aged care worker, and it said the duties of people in workplace to maintain their health and safety. The Division 4 number 28 talks about the duties of workers in the workplace. So understanding this and knowing the right person to rely on will keep us as well as our clients safe. So the duties of Work Health and Safety Act include taking care of your personal safety, 2, making sure your actions do not put other people at risk, 3, complying with the organization policies and procedure at all times. And you can assess the risk of health and safety at work by asking the following question: what exactly is the workplace violence that you are likely to be facing? If you're working as a carer, there might be clients that are a little bit aggressive. There might be their family member. There might be even staff members towards yourself. So these are the likelihood of workplace violence that is likely to happen. Physical risk, maybe someone lash out to you, just as I said earlier. Stress is a very big one because we are working with people with a lot of challenge. So sometimes it can be a little bit stressful for us to be able to achieve those goals. So we should always think about it and look after ourselves appropriately. Process of assessing and addressing risk. Different organizations have different process in place, which is of course in line with the Work Health and Safety Act. Here in WA, we are using what we call Work Health and Safety Act 2020, different from Melbourne and Sydney 2011. But most of the information that is on there are very similar, and of course they can also be used interchangeably. So this process starts by identifying identifying the risk, and it ends in how we are going to be reducing that particular risk. So risk assessment framework evaluates the risk involved in your work role and ways to minimize that harm that can bring the harm that such risk can bring to the other person. National legislation, the law, national legislation, these are few laws created to protect the welfare of older people. The law also regulates the providers of the aged care, and regulation is vital in managing the quality of services that you're going to be rendering. That is, the care providers must meet the appropriate standard, and the care provider do not abuse an older person at any time. All these are what is expected of us as aged care worker or even aged care provider. Things to do to ensure legal compliance include understanding the legal requirement of your job role. As a care worker, what exactly am I supposed to do? Understand this and don't go against or try to do out of your scope. This will be in line with the legal expectation and the legal compliance of your company. Research the provider you will work for. Try to research and try to understand what type of organization are they? Are they a reputable organization? You feel that you'll be comfortable and while you are working with them, and will you be happy even in that area? Ask if they have any accredited whether they are an accredited provider. That is, knowing whether they are always maintaining and following the law. Act in accordance with the law. Perform your job role to the best of your abilities. Follow the organization policies and procedure, and treat people with care and respect at all times. With this, you understand and you know that you are maintaining what they call compliance at all times. This is where we are going to be calling it a day today, and we are going to be starting our next video with work with interdisciplinary team member. Till then, thank you for joining. I'll see you in the next video. Bye for now.